dressing up like a doctor, personal protective equipment, and you. Are you sick of getting sneezed on when rounding? Do you get confused with straps and holds and directions? Are you convinced that alien nanowaves are controlling your thoughts and actions and forcing you to prescribe meropenem? Hi, I'm Cole Beeler. You might remember me from popular orientation videos, Always Wear Pants, and C. diff P. whiff, What's with all the Zosin? What if I were to tell you there was a product that could protect you and your family from infections, and that same product came in stylish hues of azure and gold, and yes, this product is absolutely free? Today, I'm here to talk to you about personal protective equipment, the innovative style of the future. Follow me. In the hospital, you'll use a lot of PPE. Today, I'm going to talk to you about 4 great products: gowns, gloves, masks, and eye protection. Masks come in 3 sweet styles to help you accessorize. Isolation masks protect you from large droplets that get coughed, sneezed, or even breathed at you. Surgical masks do the same thing, but are for the customer who is a bit more risque and have sultry ties in the back. Here's a list of the common situations where you might consider wearing these masks when visiting a patient. Remember, if someone has a suspicious syndrome for something that might spread through the air, you should consider wearing a mask. If you're out for a night on the ward with a TB patient, maybe an N95 mask is the one for you. Maybe your face is weird and you aren't able to wear an N95. Don't fret. We also have pappers that you can use to take attention away from your weird-looking face. These masks protect you from pathogens that can infect you via small droplet nuclei and would be a nice addition to any outfit in situations where you're caring for TB, disseminated VZV, measles, or even that rascal monkeypox. As an aside, anytime you're in a situation where you could get splashed in the eyes, make sure to put on one of your patented eye protection devices, either a face shield or goggles. Certain viruses and bacteria may also spread by inoculation into the eyes, so keep those peepers protected. Try to avoid these common examples of fashion faux pas. If the mask isn't covering your nose and mouth, you might be vulnerable to infection and looking stupid. Generally, these masks should be trashed after you use them, just like your old biochem notes. I mean, how else are we going to make money, am I right? But if your hospital is running out of our awesome product, you may be asked to reuse them in 2 separate ways. Extended use applies to situations where you are seeing a group of patients with the same infection in rapid series. In this situation, you can use the same mask between multiple patients and then discard when done. Limited reuse is a way to save a mask in a brown bag and reuse later in the day on patients with the same infection. Your hospital will let you know when you should be using these strategies. Putting on an N95 is easy. Let's watch Mitch demonstrate application. As you can see, he holds it tight over his face holes, and then puts one strap above his upper neck and then another on top of his noggin. He then forms the mask to his face to get a tight seal. Okay, he did a great job. But is he safe? Dun dun dun. To do a seal check for safety, start by cupping your hands over the mask parenchyma. This is to limit air from getting through the mask filter. Take a big breath in and then out. Do you feel any leaks around the sides? If you did, guess what? You just got TB and now you can't drink alcohol for 9 months because you're on isoniazid. Sucks to be you, intern. Even with arduous strap checking and nose wing bending, you might just be out of luck because you've got a giant disgusting beard all over your face. These people need a thing called a papper. No, that's not what you call your grandfather from Alabama or a mask you're wearing because you snore at night and have pulmonary hypertension. That's one of these spacesuit looking things. Let's watch Mo as he goes on a voyage to outer space where no one can hear you scream for extra meal tickets or vacation time. Okay, so the first step is to make sure that the floaty cap thingy is actually floating. If it doesn't float, it's broke. That's science! Okay, his looks good. So, let's start by hooking up the hood thing to that vacuum tube sucky device. Now, Once that's done, you can put the hood around your kaput Medusa, making sure that it fits snugly around the entirety of your face. It might require some adjustments. Now, hook the generator utility belt thingy around your love handles. Always make sure that it's on. It only works when it's on. Even with the perfect face wear, everyone knows that you can't show up for the ball without a gown, and everyone looks good in yellow. Everyone! Yellow is the new orange, which is the new black. Gowns and gloves are needed for preventing you from getting all the patient's germs in your nooks and crannies. They are used in situations where patients are in contact isolation, but should also be used syndromically when you think you might get something gross on you. Don't go free riding into a disimpaction. That's just disgusting. We've got lots of great gowns for you to try on. Most gowns tie in the back, and don't forget that important step. Some of our hospitals use 3-arm gowns. The best way to put on these gowns is by the hole and roll technique. It may sound like a putt-putt golf establishment or a drive-through donut store, but it's not. It's just a way to put these gowns on like you're making an intern burrito. Start by putting one arm through the hole and the other arm through the middle sleeve. Wrap the other sleeve around your back just like a jacket, and you'll be good to go. This way prevents the gown from drooping as you bend over. Now, there are multiple ways to fold this burrito, but only one way that doesn't turn into a sloppy mess. Please assure our products are worn as approved. If not, you'll get explosive diarrhea. All right, let's look at everything together. Just like any time you're getting ready to party, start the pregame with alcohol and wash your hands first. Scrub for a minimum of 20 seconds. That's 2 happy birthday songs, paying special attention to the tips of your fingers, thumbs, interdigital spaces, and backs of your hands. Next, you can put your mask on. Make sure that you form it to your face after you're done. If you watch Mitch here, he does it absolutely perfectly, and he follows it up with a seal check to make sure that the mask is still working around his face. After you're done with your mask, you're ready to put your eye shield around your forehead. It should fit snugly. Last but not least, you have your gloves and your gown. First, put on your gown using the patented hole and roll technique. One hand through the hole, one hand through the middle, and then wrap it around like a jacket. That's a great job, Mitch. Okay, next is the gloves. Your gloves should fit over your hands and then over your cuffs. This is to keep the cuffs as decontaminated as possible to make doffing easier. Even though you're essentially unrecognizable at this point, the patient will recognize that you care about their well-being and that you look like a yellow riot officer or Supreme Leader Snoke or the cherished taciturn Autobot. Regardless of what you look like, you're ready to go. Let's look at how you escape from these garments of gratuitous grime. All right. To take off all your equipment, make sure to start by washing your gloves off. This will make the doffing safer and keep your hands uncontaminated. Yes, this process is weird, but so is everything we do. Once you clean your gloves, remove them and make sure not to touch any of the contaminated side of the glove to your skin. After your gloves are off, slip your hands out of your cuffs. Let the extra sleeve of your gown fall behind you. And then, with a little jig, you can push with your other hand to remove the rest of the gown, roll it up, and place it in the designated bin. You're going to want to wash your hands again after this and get a new set of gloves. See how Mitch has a new set of gloves on here? You should too! Now, you can take your eye shield off. The eye shield should be cleaned with approved hospital disinfectant wipes. Make sure you get the entire surface that could have contaminated buggies on it. Once the mask is cleaned, you can walk with it outside of the room with your mask. When you're outside, you're going to want to make sure to wash your hands again and get a new set of gloves. This is to make sure that you take off your mask safely. Once the mask is taken off, it can be put in a brown paper bag. Is that too many steps with all of this? Oh, my bad. I thought that you were a doctor. Well, if you aren't a doctor, you're ready to be one now, because this is literally the hardest thing you will ever have to learn. Calculating hypertonic saline dosing, reading a junctional rhythm, diagnosing a UTI, all of these things are easy compared to wearing clothes. Now you can do anything. Just remember, the most important piece of personal protective equipment is your mind. Just kidding, it's the N95! No residents were harmed in the filming of this video and partook of this torture of their own free will. Kinda like all of residency. Thanks for watching.
Doing well overnight, no fevers, able to come off the pressers, oxygenation's getting